my name is Leandra Coley, and I will be talking about the etiology and reservoir of the disease influenza. I'm going to start off by talking about the etiology of influenza. The etiology is defined as the study of the cause of the disease. Influenza, also known as the flu, is a viral disease and can be caused by three different virus types: type A, type B, and type C. The morphology of the influenza viral infection is classified as the envelope virus. The roughly spherical-shaped virus contains a genome of 8 segmented negative strands of RNA. The influenza virus enters the cell through the process of endocytosis. The virus is able to do this because of the glycoprotein on the outside surface. Once the virus is inside the cell, it takes approximately 6 hours for the replication process to be completed. An interesting fact about the influenza virus is that this virus can go through the process of antigenic shift or antigenic drift. Antigenic drift slowly mutates to seasonal flu viral strain, which is why we need to get a new vaccination each year. Antigenic shift roughly occurs when two different influenza viral strains combine and affect the same cell. The reservoir is the continuous, naturally occurring source of the disease-causing microbe. As mentioned before, the influenza virus has 3 different types: type A, type B, and type C. Type A influenza affects both animals and humans, while type B and C affect mostly young children. The main reservoir for type A influenza would be aquatic birds such as ducks or geese. Type A influenza can cause a respiratory disease in humans and animals. A few cases have shown that pigs, seals, ducks, and chickens are the reservoir for this disease.
Hi everyone, my name is Doug Brooks and I'll be covering the transmission and the signs and symptoms portions of the influenza virus. And we'll begin with the transmission. The influenza virus is primarily found on the large particles of respiratory secretions from an infected person. The large particles only remain suspended for a short period of time and travel a distance of about 6 feet. Consequently, close contact with the infected person's respiratory secretions, like those from coughing or sneezing, is the primary mode of transmission. Studies have shown that the influenza virus can survive on surfaces for 2 to 8 hours. However, contact with infected surfaces is not a well-established mode of transmission. There's also some evidence that the influenza virus can be transmitted via the transocular route. The incubation period, which is the period of time between exposure to an infection and the appearance of the first symptoms, is about 1 to 4 days. And most people infected with influenza can begin transmitting the virus to others a day before symptoms develop and up to a week after becoming sick. Infectiousness usually peaks within 24 to 48 hours and continues for an average of 5 days. After infectiousness peaks, it rapidly declines, but may continue for up to 10 days or more. In children and individuals with weakened immune systems may pass on the virus for an even longer period. Consequently, the CDC recommends that people stay home for at least 24 hours after their fever is gone to cut down on transmission. In summary, influenza is primarily transmitted via respiratory secretions and can be transmitted to others before the development of symptoms. Infectiousness usually peaks within 24 to 48 hours of illness, and then it rapidly declines. And the CDC recommends that people with influenza stay home for at least 24 hours after the disappearance of their fever. All right, so now we're going to go over the signs and symptoms of influenza. Keep in mind that with influenza, at least, many of the signs and symptoms can go either way. For example, nasal discharge can be described as a symptom, but it can also be observed by a healthcare professional. So I tried to break it down as best I could, but just keep that in mind as we go through it. One of the characteristics of influenza is that it usually begins very abruptly. In some cases, it's so abrupt that the individual can remember exactly when it started. The main sign of influenza is fever, while the primary symptoms are a headache, myalgia, and malaise. The fever can range from about 100 to 104 degrees and may be accompanied by chills. It typically lasts 2 to 5 days, which is usually longer than the 24 to 48 hours for other respiratory viruses. And fevers are often higher in children than adults. Influenza often brings a frontal or a retroorbital headache and can be quite severe. Myalgia, which is muscle pain, is common and can range from mild to severe. Malaise is severe fatigue that often prevents patients from performing their normal daily activities or going to work. And most patients will need extra sleep, and some will even be bedridden. Typical secondary symptoms include a non-productive cough, nasal discharge, and sore throat. A non-productive cough and other respiratory symptoms may initially be minimal but frequently get worse as the illness progresses, and the sore throat usually lasts 3 to 5 days. Gastrointestinal illness, such as vomiting and diarrhea, usually doesn't occur in adults with influenza, but can occur in children 10 to 20% of the time. So the stomach flu, or gastroenteritis, is not caused by the influenza virus. The most common influenza complication for adults is pneumonia, and in children, it's otitis media, pneumonia, and asthma complications. So in summary, influenza presents with characteristic abruptness. The main sign is fever, and the primary symptoms are headache, myalgia, and malaise. A sore throat, nasal discharge, and non-productive cough may be present early on, but typically get worse as the illness progresses. Vomiting and diarrhea usually do not occur with influenza, and the stomach flu is not caused by the influenza virus. Patients without complications usually improve over 2 to 5 days, but sometimes it takes longer.
Hi, my name is Derek Despot. In this video, I will be covering treatments, prevention, and control for influenza, as well as a few additional facts about the virus. As we have already learned, influenza, or more commonly known as the flu, is a virus. So, to be able to treat a virus, one would need to take an antiviral drug. Tamiflu or Relenza are two of the more common antivirals that doctors prescribe for the flu virus. If taken soon after you notice symptoms, these drugs may shorten your illness by a day or so and help prevent serious complications. The Centers for Disease Control and Prevention recommends annual flu vaccination for everyone over the age of 6 months. Each year's seasonal flu vaccine contains protection from the 3 or 4 influenza viruses that are expected to be most common during that year's flu season. The vaccine is typically available as an injection or as a nasal spray. The quadrivalent flu vaccine protects against 2 influenza A viruses and 2 influenza B viruses. Common prevention techniques include washing your hands frequently and thoroughly throughout each day. Whenever you or another has the urge to sneeze or cough, try to cover or contain that urge. And lastly, try to avoid places with a lot of people, as exposure to other infected people may lead to your own infection. Now some additional facts. Here's an article for CDC's website about why they are forced to estimate the number of deaths related to influenza. CDC does not know exactly how many people die from seasonal flu each year. There are several reasons for this. First, states are not required to report individual seasonal flu cases or deaths of people older than 18 years of age to CDC. Second, seasonal influenza is infrequently listed on death certificates of people who die from flu-related complications. Third, many seasonal flu-related deaths occur 1 or 2 weeks after a person's initial infection, either because the person may develop a secondary bacterial co-infection, such as bacterial pneumonia, or because seasonal flu can aggravate an existing chronic illness, such as congestive heart failure or chronic obstructive pulmonary disease. Also, most people who die from seasonal flu-related complications are not tested for flu, or they seek medical care later than their illness, when the seasonal influenza can no longer be detected from the respiratory samples. Sensitive influenza tests are only likely to detect influenza if performed within a week after onset of the illness. In addition, some commonly used tests to diagnose influenza in clinical settings are not highly sensitive and can provide false negative results. For these reasons, many flu-related deaths may not be recorded on death certificates. Like most diseases, young children, older adults, and younger people with weaker immune symptoms sometimes become sicker from the flu virus. This is also true if you have a condition such as heart failure and lung disease, asthma, or diabetes. Having the flu while you're pregnant increases the risk of premature labor and delivery. In 2003, there were 105 deaths of children related to this virus. You can pass the flu to others from 1 day before you have the symptoms up to 5 to 7 days after you get sick. Some people might be able to infect others even longer. And in the information section of this video, we have uploaded a link to show worldwide deaths related to the influenza virus. And hopefully that will give more insight as to how deadly this virus or infection is. So thank you for watching our video. Hope you enjoyed it.